In this second video all about the honeybee sting, I'm going to be talking about the human body's reaction to bee stings. Now I want to tell you a couple of things up front. First, if you have any questions about your body's response to honeybee stings, you really need to discuss this with your allergist. I'm not a medical doctor, so it's very important that you have these discussions with people who can answer your questions directly. Secondly, if you believe that you are experiencing a life-threatening response to a bee sting, you need to call medical emergency personnel immediately. Honeybee sting, you're going to get stung. And the pain associated with the bee sting is usually the most difficult pill to swallow for most beekeepers. But unfortunately, there are also other responses that the body can have to bee stings. In fact, medical personnel, depending on which one you ask, generally recognize about 6 different categories of human body reactions to bee stings. The good news is, very few people are actually truly allergic to bee stings from a standpoint that if they are stung, they're going to experience a life-threatening emergency. In fact, some medical journals suggest that it's somewhere in the neighborhood of about 0.5% to 4% of the human population that would experience a life-threatening emergency when stung. So now I'd like to discuss with you those 6 categories that outline the body's response to the bee sting. And as I go through these categories, we're getting increasingly worse responses to bee stings. So the lower the category number, the less response, or the less significant the response, the greater the category number, you might consider reaching out to medical emergency personnel. Category 1, normal non-allergic reactions at the time of sting. When you get stung, you might experience sharp pain or burning at the sting site that will intensify for a few minutes. The good news is that intensification will actually begin to decrease over time. You may also experience redness or swelling at the sting site, which may be tender to the touch. Finally, you may have a white area form immediately around the puncture site. Category 2, normal non-allergic reactions after the time of sting. In this case, you might experience itching, redness, swelling for a number of hours, or that even last for a few days. You may also get small brown or red damage spots at the puncture site. Category 3, large local reactions. In this category, you may experience rapid or massive swelling around the sting site, with the swelling extending considerably further than the sting site. So, for example, you may get stung at your wrist, but your arm begin to swell even up to above the elbow. That swelling area can increase in size for 24 to 72 hours or longer. Anyone experiencing a large local reaction in the mouth or neck area, especially if the swollen area is beginning to restrict airflow, should seek medical attention immediately. Category 4, cutaneous allergic reactions. In this category, you may get a rash anywhere on the skin, even away from the sting site. You can also have massive swelling away from the sting site. You can experience generalized itching and redness of the skin, again at the sting site or even away from the sting site. The medical community debates the seriousness of this reaction. However, when in doubt, seek medical advice. Category 5, non-life-threatening allergic reactions. This is a little bit misleading as a category title because it is a fairly significant allergic reaction that's usually not life-threatening. I always tell people when discussing this category that if you're experiencing these symptoms, you should seek medical attention immediately and let a medical professional diagnose your condition. This category can include allergic inflammation inside your nose and around your eyes. You might experience minor respiratory symptoms or even abdominal cramps. You can experience severe gastrointestinal reactions that include nausea, vomiting, and diarrhea. You can have weakness, and you may even have fear or other subjective feelings. Category 6, life-threatening allergic reactions. This is the most significant of all these categories, and if you experience these symptoms, you should seek medical attention immediately. These symptoms include shock, dizziness or unconsciousness, abnormally low blood pressure or fainting, difficulty breathing, massive swelling in the throat, face, tongue, or mouth, or rapid pulse. Now that you know the symptoms associated with each of the 6 categories, I'm going to take a step back and make some general comments. In general, Categories 1, 2, and 3 represent normal local reactions. In other words, they're things that are happening to your body near the sting site, and usually medical intervention is not needed in these cases. Categories 4, 5, and 6 represent allergic or systemic reactions. In other words, your body is responding to the sting away from the sting site. Generally speaking, Category 4 does not represent a life-threatening situation, while Categories 5 and 6 can. So I usually tell people if you experience symptoms that you find in Categories 5 and 6, you should seek medical help immediately. But as I've already stated throughout this video, anytime you have a question, speak with your allergist. Anytime you experience a worrying symptom, seek medical attention immediately. As a final reminder, if you have any questions about your body's reaction to stings, see your allergist. And again, if you believe you are having a life-threatening reaction to a sting, you must seek medical attention immediately.